Hello, my name is Faith. I will be administering Compassine in a 10 milligram. I am Ralph to my patients. Before I do that, I'm gonna make sure I double check my medication against my MER with the doctor's order and also with the medication itself against the MER. So that's two checking off my to check my right medication. At the third time, I'm gonna also check it with the patient. So at the patient's bedside, I'm gonna make sure I check the history of my patient, their medication history, and just to know what medications they're taking. Just because we don't want anything interacting in a negative way with the composite medication. All right, and before I go into the patient's room, I'm gonna have draw out my medication. So I'm gonna get my medication. I'm gonna go into the patient's room. I'm going to introduce myself. Let the patient know what I'm there for. I'm also going to ask for their name and date of birth, and also any allergies that they might be experience or they are aware of. Before I administer the medication, I'm going to let them know the side effects, which is constipation, blurred vision, dry mouth, and also dry eyes. So that is something that they might experience or they might not experience. But they're supposed to report to me or to a nurse if they experience any of the side effects. So we're preparing for my medication. I'm going to have a filter needle and a regular needle. The needle size needle gauge will be 20 to 25 inch, and also the needle length will be 1 to 1.5 inch needle length. So first, I'm gonna start by drawing the medication from the ampule with a filter needle, and this is because we don't want any sharps or any broken pieces of the ampule in the medication. To get out with my ampule, I'm going to use an alcohol swab to break it up. I'm supposed to break this up, but just because we don't have enough, I'll try not to. But when you're opening the ampule, you want to break it away from you using an alcohol swab so you don't hurt yourself or bleed out. All right, now I'm going to have my filter needle. Have it out. With my vital turned upside down, working of course. I'm gonna withdraw 10 milligrams. I'm going to make sure that there isn't any bubbles, and if there is, I'm just gonna shake it up a little bit, and that should clear out the bubbles. And then at the patient's bedside, I'm going to also exchange my needles. All right. Gonna wash my hands and apply gloves, and I also wash my hands and apply glove before I drew out the medication. So I'm gonna change it up to administer the medication to my patients. So my hands have been washed, and now I'm applying gloves. I'll be administering this medication in the deltoid, which is a site for an IM medication. I will be using my landmark, which is the acromion process, and also the axillary area of the arm. So with the acromion process and the axillary area, I'm gonna read right here, which is where I will be administering my medication. I'm gonna wipe the site with an alcohol swab to prevent any infection or any bacterials or just whatever that might contraindicate with the medication.
Yeah, I know, dude. I like this gown. I can't just like unbutton it.
All right, in a 90-degree angle. I'll be administering the medication and fast.
Oh, I'm not doing anything on the side. Oh.
Just gonna clean it up a little bit without applying pressure. I'm going to dispose my needle in the needle disposable bucket. But I'm not doing that now. But none of that work. I'm gonna make sure the patient is aware of the side effects, as I previously said, and make sure they're not experiencing any of the side effects. Monitor them in about 15 to 30 minutes to see if the pain has been released or if there is anything that, like any side effect that they might have experienced. After that, I am going to take my gloves off, wash my hands, leave the patient's room, go to the computer, and against the MAR, document everything that I did, go through the patient's 6 rights. So I gave the medication to the right patient, I gave the right medication, the right dosage, the right route, which was the IM, at the right time. So I'm gonna complete my documentation with my initials.